And now, data gathering and management remains key to improving the response for Nigeria's control of HIV, tuberculosis and malaria.
This is a summation of discussions at the 2018 National Joint Annual Program Review meeting for HIV, tuberculosis and malaria taking place in Abuja. TVC News' Kemi Balogun has more on this.
Over the last 2 decades, Nigeria has made some progress in the control of HIV, tuberculosis and malaria. But these 3 diseases continue to constitute a major public health problem in the country. UNAIDS and the National Agency for the Control of AIDS estimate that there are 1.9 million people living with HIV in Nigeria. In the past years, the country had established various platforms and mechanisms to review its performance in the 3 disease areas and proffer policy and recommendations for improvement. And for the first time, this joint annual program review meeting is one of these platforms.
We did not have as many people as we thought living with HIV. We need to know who has TB. The good news about TB, it's curable. And then for malaria, especially for pregnant and young children, we need them to rest, sleep under insecticide-treated nets.
You actually showcase what we've done, the achievement in the past 1 year, the priority for the next years, and also telling the world the challenges we have and how to resolve the challenge. So it's very important for NACA doing that. Yeah.
The joint annual program review seeks to consolidate on the contributions of this platform, harmonize and build consensus on key issues of data gathering to inform policy and programming at all levels of service delivery.
Nigeria has the highest level of mortality due to malaria. It has the highest proportion globally of people living with tuberculosis that remain untreated. And it is the highest number of people living with HIV in West and Central Africa. So what attention to these 3 diseases matters not only for Nigeria, but we can't make progress globally unless we make progress here in Nigeria. And this involves not just in terms of the quality of the programs, strategies, how we use data to understand what's working and what's not in the fight against the 3 diseases.
Key players in this sector are calling for an urgent improvement in data gathering because that is the only way there will be enough control on HIV and AIDS, tuberculosis and malaria. Kemi Balogun, TVC News, Abuja.